Hello and welcome to my lecture on the gallbladder. There are 4 things you need to remember in terms of the gallbladder and stones. One is cholelithiasis, the second is cholecystitis, the third is choledocolitis, and the fourth is cholangitis. Cholelithiasis. Now look at the name. A lith is a stone, and it's a very fancy way of saying that there are stones in the gallbladder. Now, another thing I want you to notice is a lit. It's like let it be. And that's what you do, especially in the asymptomatic cases. You would diagnose it by visualization of stones on right upper quadrant ultrasound. But if there's a little bit of symptoms that are not quite biliary colic but getting there, you prescribe ursodeoxycholic acid. But if it progresses to a point where there is inflammation and infection of the gallbladder, when you have right upper quadrant pain that is more than intermittent and that radiates to your right shoulder, and when Murphy's sign is positive, you need to take some active measures. And that includes making the patient NPO, giving IV antibiotics, and giving IV fluids. And eventually, in about 3 days, you get the gallbladder removed by an elective cholecystectomy. Choledocolithiasis. Well, that's quite a mouthful. It has an extra CO in its name, which kind of sounds like a common bile duct, and that's exactly where the stones go. The stones go into the common bile duct, causing jaundice, fever, and severe right upper quadrant pain. The main clinical differentiating feature between choledocolithiasis and cholecystitis is the nature of the pain and the presence of jaundice. Again, you would make the patient NPO, give IV antibiotics and IV fluids, but you must do an ERCP. I mean, look, this is such a long word, it's so compressed, I feel like decompressing it, and that's what the ERCP does. And then after that's accomplished, you would then schedule an elective cholecystectomy. Cholangitis. Cholangitis is a very severe infection. It contains either a Charcot's triad and or a Reynolds pentad. And basically, a Charcot's triad is right upper quadrant pain, jaundice, and fever. And if you add hypotension and neurologic symptoms, you get Reynolds pentad. You need to remove that stone right away. So ERCP immediately, followed eventually by a cholecystectomy. And that's my lecture on the gallbladder part 1. Please subscribe to my channel.